On today's episode, I'm talking all about the use of CBD oil to treat epilepsy in dogs. I'm then moving on to the use of rescue remedy to treat a stressed out cat. Another question is, what grains are considered to be beneficial and the healthiest to include in a dog's diet? Heart disease in cats, is it painful and what's the prognosis? And then finally, how can you get drops and eye medication into a dog with a painful eye who really doesn't want treatment? But first, here's the intro.
You're listening to the Dr. Alex Answers podcast, the show that answers all of your dog and cat health questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Hi, and welcome to episode number 8 of the Dr. Alex Answers Show. I'm Dr. Alex, the veterinarian behind ourpetshealth.com, where my aim is to help you and your pet to live a healthier, happier life. And I'm so grateful that you're spending your time with me by tuning into today's show. And I hope that you really enjoy today's questions and answers. And if you do, then make sure that you're subscribed to the podcast so you don't miss out on these weekly episodes. I've got loads more valuable episodes lined up that you just won't want to miss. Now, you can also get your question answered just by heading over to dralexanswers.com. Okay, and before we get going, I'd also like to read you this little review that the listener 18 Davis 18, that's their iTunes name, left me, and it says, great pet content and great accent. We're a dog loving family and Dr. Alex is a dog loving kind of guy. Great content. In what I've heard thus far, he goes fairly quickly through his questions and answers, getting down to business and not wasting much time with dilly-dallying. If you are a pet lover and owner, I say give Dr. Alex a go for your next commute. So thanks for that review. Really lovely to hear some feedback. Yes, I kind of try and go through my answers pretty quickly. I'm just kind of conscious of your time and respectful of your time when I know there's other things you can be listening to. If you've got other questions as a follow-up, then please just let me know. But also, if you head over to ourpetshealth.com, then I've got heaps of information there that will go into a lot of these topics in a lot more detail. So if that's something you're interested in, definitely head over there. And also in my other podcast, the Our Pets Health podcast, I go into more detail about specific conditions in that one as well. So definitely check those things out. And also, if you would love to leave me a review, then I'd love to receive it. You know, it helps more than you can imagine with other people finding this podcast and allows me to help more pets, which is really what I'm all about. Okay, so let's get on to the first question. And the first one is from Pael, who's got a 7-month-old beagle, who says for the last month he's started to get seizure attacks, and within the last 2 months he's had six seizures, 6 attacks, and he's asking, can I help him know how he can use CBD oil to treat these seizures? What amount should be given? Any brands that I can recommend? And can I recommend which CBD oil would be best to help this dog? So the first thing I'm going to say is that we really need to try and determine the cause of the seizures. So seizures can be caused by a number of different things. It can be caused by organ disease, infections, poisoning, brain lesions, and then epilepsy. So in a younger dog, epilepsy is definitely one of the main differentials, although this one is quite young. Normally, epilepsy starts maybe from about a year old, although it can be from 6 months. So it certainly fits in from that point of view. Now, if we're talking about epilepsy as a whole, then, we also need to think about when do we want to start treatments for these seizures. So generally that's if a dog has had 2 or more seizures in a 6-month period. Certainly if they're having more than 1 seizure a month. We also want to think about treating them if they've not recovered between seizures, or if they're having severe seizures, or if the recovery in general is very long. So that's kind of some triggers to start treatment. And if the seizures aren't caused by epilepsy, then we really need to try and address the underlying cause. So we also get developmental problems, so anatomical problems in younger dogs. So that can be things like fluid on the brain, water on the brain. And we need to kind of be addressing those causes. It could be a liver shunt or something like that, which can also cause seizures. So we don't want to assume that just because it is a young dog, and maybe they otherwise seem to be pretty normal, that epilepsy is the cause. We also need to think about trying to find out the underlying cause, because if it's not epilepsy, then often they won't respond as well to anti-seizure medication alone. We will need to give other things, give other drugs, use other interventions to try and get these pets seizure free, or certainly to reduce the frequency and the severity of these seizures. Now, next, when we're thinking about treating seizures, we need to think about choosing the best anti-seizure medication for that individual. So with drugs like phenobarbital and imepitoin, they're our first line, our frontline drugs that we use to treat certainly epilepsy in dogs. We know how effective they can be. We know what to expect with long-term administration. We know how to monitor for potential side effects, and that's really important. So if we think of CBD oil, then research actually into its use to control seizures is just in its early stage. There are some current investigations going on, some current studies being run, but we don't know exactly the details yet. We don't know which dogs they're going to be most effective in. Do we need to use the CBD oil with additional medication? Are there concerns with giving it? Will it actually make things worse? Are there side effects that we need to know about? So although these studies are starting to run, we need to think about why we're going to try a drug that we don't know how we don't know much about. We don't know how well it's going to work and all those other things. Why are we thinking about using a drug like that when we've got other drugs in our arsenal, if you like, to treat seizures and certainly to treat epilepsy? So we need to be clear, there's a lot of information online. There's a lot of hype. There's a lot of people who are very enthusiastic about the use of CBD oil and about its treatment for any number of conditions, from epilepsy, certainly one, from arthritis and pain. And we've actually got a little bit of information about its use as a painkiller, from an anti-cancer drug, for an anti-allergy drug, from an anti-anxiety point of view. CBD oil is being touted as the next big thing to treat pretty much anything. We really need to be careful. If you want to know more about this topic, then I've actually written about it in a lot of detail. Check out the show notes for the links to that article. And that talks about, the use of CBD oil in the treatment of seizures, but also anxiety, arthritis and cancer. And I've also got another article about the risk of marijuana. So if you're thinking, well, medical marijuana might be an option, well, that's something we really need to consider, because actually the THC in that can be dangerous. So you definitely need to know about that if you're thinking of using any kind of medicinal marijuana products. So, that's something to think about. As for what dose to use, and what supply to use, supply is really going to depend on where you are in the world. We definitely want to be, if you're thinking of using a CBD oil, we definitely want to be using a product that has had some independent analysis done to confirm that actually it's got what it says it's got, and it's got low to zero THC in it. And that's going to vary depending on where you are in the world. So I wouldn't like to give you any kind of brand. And as for dose, I make a point of actually never giving doses for drugs, because I don't think that's the place for me. I don't think it's the place for anyone online. I think dosing and individual treatment plans should be overseen and recommended by an individual vet after examining that patient. I think that's the only sensible way. That's the only safe way to go about treating an individual. So, I certainly make a point of never giving doses. But, I hope that gives you something to think about if you are thinking about using CBD oil to treat any form of seizures, certainly the treatment of epilepsy.
You're listening to the Dr. Alex Answers Show.
Okay, so question number 2 was sent in by Britt, and she's got a couple of cats, and one of them has become super stressed out. She's tried Fellaway, she's tried using a herb collar, which helped a little, but not much, and now she's moved on to trying Rescue Remedy. And it seems to have helped, but she's wondering, where does she put it? How does she administer it? How, again, what dose? Kind of how many times a day should she be using it? So she said she's used Rescue Remedy herself, and she knows it well for people, but not so much for animals. And then she also asks, is there anything else that she could do or she should be doing for her stressed out cat? So to start with, stress in a multi-cat household is really common, and Britt has got a couple of cats. It's something that, it's great that she's recognised, because I think a lot of us don't necessarily appreciate the stress that our cats can be under. But then other things such as pain can cause similar problems to what she's seeing. And any cat with a change in behaviour should be checked to ensure that nothing else is going wrong, and to get specific recommendations as well, tailored to your specific cat, specifically from your vet, which goes back a little bit to my last question. And then we can actually take steps to reduce the causes of stress rather than just to medicate. So if we've got a stressed out cat for any reason, if we can identify the cause of that stress, and remove it or lessen it, then that's going to be much better than simply giving medication, trying different supplements, and trying to treat it. So definitely trying to eliminate it from the environment, if you like, is really important. So to start with, we should have one more food bowl, one more water bowl, and one more litter tray than the number of cats in the house. So if we've got 2 cats, that means 3 food bowls, 3 water bowls, 3 litter trays. And that's in separate locations as well. If you've got 3 cats, it's 4 food bowls, and etc. So, you can quickly see how if you've got a lot of cats, then you need a lot of resources. And that's because the competition for these resources is a really big cause of stress. Now, another thing, we also need to have escape routes. So rather than just have 2 cats shut in the same room in close proximity, if they're not getting on, they've got nowhere to go. We want to have escape routes and safe spaces as well that a cat can get to and a cat can hide away in and feel safe. And cats are really 3-dimensional in their outlook of their environment. So having spaces up high or tucked away kind of at the top of a wardrobe or in a cupboard, under a bed, up high, down low is really important. Now, if we move on to medications, some people will swear by rescue remedy, and typically they'll give a drop or 2 several times a day. And actually, I've had kind of a little bit of a change in my beliefs recently, and I think it's always important that we kind of reevaluate things, and we don't just kind of take things for granted, or we look into things a little bit more closely. Because I used to believe that actually that rescue remedy, it could be classed as a herbal supplement, and so could potentially be beneficial. But I've recently been looking into it in a little bit more detail as I've been looking at different supplements. And a bit of background. It was first produced in the 1930s by an English homeopath. And, when he was feeling a certain emotion, all he did is he held his hand over various different plants. And the one that made him feel better, he ascribed kind of the healing power to cure that negative emotion to that plant. He then collected the dew from the plant, feeling that the plant would have transferred its energy into the water that was sitting on the petals, and then that was mixed with the same amount of brandy to produce something called a mother tincture before being further diluted in alcohol to produce the final therapeutic product. Now, it's not produced in the same way as homeopathic remedies. In the dilution is not so great, and there's not this concussive step to transfer the energy. So in homeopathic remedies, they take a drop of a substance, they dilute it in a lot of water, and then they kind of bash it against a leather strap to transfer the energy before diluting it again. So we don't undergo kind of that step, but it's got very similar underlying philosophies. Now, in commercially produced things, so like rescue remedy, which is actually kind of the dew, if you like, from 5 different flowers, if the dew can't be collected, then the initial step is the water actually having the flowers and the petals from the plant soaked into it, with the sun's rays being allowed to pass through them, or if that's not possible, actually just being boiled. And then there's actually no evidence at all that rescue remedy has any effect, unsurprisingly, given that's how it's produced. And really it's the same principles of homeopathy. It's not something that's got any logical action. It's got no evidence to support it. It has been looked at, and really rescue remedy is now something that I wouldn't recommend. If you're interested in homeopathy in general, then check out the links in the show notes to a piece that I've done all about homeopathy that discusses that in far more detail. But there are other things that we can do. So Fellaway does help, and Britt has actually tried that in her cat. But it shouldn't be the only thing that we do. It does need other things to help it, and that can be managing the environment, like I've discussed. There are other supplements that we can use that are kind of more like herbal dietary supplements, and that's like Carmex and Zilkine, which have limited evidence to prove their effect, but there is some evidence out there. And then we've also got proper pharmaceutical products such as clomiparamine, which is an anti-anxiety, an antidepressant treatment that can really help in reducing stress. We want to be using that in for kind of short-term use, ideally, and it's not something we would reach for in every single stressed-out cat. But for a cat that's really struggling to cope with their environment, that's definitely something that we can consider. But obviously, that needs to be prescribed by a vet, and again, kind of used with changes in the environment as well, so that a cat isn't just put on medication and left on medication for a long period of time. Okay, before we jump into the next question, I just wanted to let you know that this podcast is brought to you by the ourpetshealth.com Guide to Stress in Cats. So this is the free guide that helps you to recognise the signs of stress and gives you steps to take to help your cat relax. So to get it for free today, just head over to dralexanswers.com and follow the link to the resources section. My next question is from Carla, who asks, with the implication of grain-free and exotic ingredients in a dog's diet, what grains are considered to be beneficial and the healthiest for a dog? She knows that corn and wheat are not at the top of anyone's list, but what grains should she be thinking about feeding her dog? So to start with, for those of you who aren't aware, so grain-free diets have been implicated as the cause of heart failure in dog breeds that would not normally get that particular type of heart failure. And it's not just grain-free diets, it's also boutique food brands and exotic ingredient diets, and that includes raw diets that have been implicated in this. And check out the show notes for more discussion about that. If you need more information, definitely check it out if you are feeding your pet a grain-free diet. We don't know what the cause is. It's not taurine, which is something that's been talked about. An investigation is ongoing, so hopefully we'll have an answer about that soon. So let's start with the fact that dogs have no absolute requirement for carbohydrates, meaning that they don't have to have carbohydrates in their diet, but they have evolved to be able to digest and to make use of them. So they have different genetics to wolves, and they are able to digest grains, and they are able to utilize them in their diet. So grains are made up of a number of different things. They're the seeds from different grasses, and they include things like barley, rye, spelt, and wheat. We get gluten-free varieties, corn, oats, and rice. And then there are the pseudo grains, which are seeds from shrubs and other plants, and that's things like buckwheat, millet, and quinoa. So grains, really, what are they? Well, they're the seeds, like I've said, but they're actually complex carbohydrates made up from starch and fibre. So that's really what makes them up. If we think about refined grains, so things that have been heavily processed, then they really only include something called the endosperm, which is simple starch and proteins. Now, if we move on to whole grains, so that haven't been processed so much, then that contains bran, which is really fibre rich, and that's the outer layer of the grain. It's good for intestinal health, and the bran is also rich in vitamin B and other minerals. And then the whole grain also includes the central germ, and that contains vitamin E, the B vitamins, antioxidants, and some fats as well. So whole grains, really, they're much more nutritious than highly refined grains, which probably won't come as any surprise to you. Also, what grains are healthy to feed to a dog? So having said that, dogs can digest grains and they can utilize them, grains shouldn't be utilized as a substitute for high quality animal protein. So we're not talking about using grains to completely replace the animal protein or the kind of the meat, if you like. We're just using it as an addition to a diet. Now, some dogs are allergic to specific individual grains. So that's individual grains, not all grains. Wheat is actually the most common allergy or grain allergy that dogs have, but the risk of this is greatly overstated, and it's definitely not the most normal reason for food allergies. So by far and away the most common food allergies that animals and dogs experience are to the actual animal protein. So that's things like beef, chicken, and dairy, which are the top three causes of dietary allergies. Wheat then comes next. Now, some dogs do have a gluten sensitivity, and really, that's kind of often breed related. It's genetic related. Irish setters are the most likely to have this, but again, it's not really common. So in the vast majority of dogs, grains can be a valuable source of nutrients. Whole grains are generally more nutrient rich. So rather than talking about which grain in particular, I'd be saying whole grains are definitely the best. And that's, something we should be thinking about. They're more nutrient rich than highly refined grains. But that said, they shouldn't make up the bulk of a diet. The reason this is an issue is that refined grains, especially, they are very cheap, and so they're often used as the main component, the main bulk of a diet, especially in cheaper diets. So, we want to be thinking how much grain is in a diet. We don't want it to be the main thing, and also what type of grain. So rather than the specific plant, if you like, we should be thinking about whole grains rather than refined grains, ideally.
Get your question answered at dralexanswers.com.
Right, so next up is a question from Miri, and she has a cat that's been diagnosed with heart failure that was only diagnosed when the disease was quite advanced. And she is wondering if the disease really is irreversible like she's been told, and also, is it painful? Is it something that is causing pain to her cat? She's also asking what medication there is to treat it, and then ultimately what the prognosis is. So my first comment would be that cats are really good at hiding disease, and so often, especially with heart disease, it won't be picked up until late. So definitely don't feel guilty about, not realizing that your cat was in heart failure. So cats will modify their behavior to kind of hide their disease. So whereas a dog will run and then will collapse, a cat will just kind of slowly kind of reduce their activity. They may be sleeping more, they're not going to exercise, and so you might not pick up anything. You're not going to pick up a breathlessness or an exercise intolerance or an inability to chase a ball, if you like, because they just don't carry out those behaviors. So don't worry, don't feel guilty about that. Now, in most cases, the changes are irreversible, especially when they're picked up late. If it's early, then they may at least be partly reversible if there is an underlying cause. So I guess the classic examples of this would be a taurine deficiency, which we don't really worry about so much anymore, because certainly cat foods have been have extra taurine added to them because we know about this. This was a problem, I believe it was in the 80s, when we weren't aware that taurine was linked to heart health, or an overactive thyroid. So hyperthyroidism can also cause heart disease. And if we're picking that up in the early stages and we're then reversing that overactive thyroid or that increased levels of thyroid hormone in the blood, then we could potentially reverse some of those changes within the heart. Now, as a condition, it's not painful. It causes a cat to be tired, to be weak, to be short of breath, especially as it's getting worse, and then and the lack of exercise isn't enough to compensate for the fact that the heart's not working well. Now, what is painful, or what potentially is painful, is the risk of a blood clot forming, and that blood clot then kind of breaks off from within the heart and it blocks an artery. So actually the aorta, which is the main artery coming off the heart, it blocks the aorta, or the vessels feeding off the aorta that go to the back legs. That's something called a saddle thrombus, or aortic thromboembolism, and that is really painful, because what happens is the blood doesn't flow to the back legs, and they start to die, and that's really painful. But the condition as a whole, if that's not happened, it's not painful. It's going to affect a cat's quality of life, and it's going to affect how they're feeling, but I guess pain itself isn't necessarily something that they're experiencing. And then, if we're talking about the distress that heart disease and heart failure can cause, well, at the end of the disease, when it's becoming all too much for the cat and the body to take, then effectively the lungs or the chest very often are filling up with fluid, ultimately causing suffocation, and that can be very distressing for a cat, as you can well understand. Now, as far as treatment goes, I always struggle with treating cats with heart failure, because there's not much good quality evidence that shows very much of what we do makes a really significant difference. So often it can be very frustrating to treat. We're not getting the same response that we do in dogs, for example, with heart failure. But there are a few things that we can use and that we do use, and that I feel probably do make a difference. So frusemide or furosemide is one of those things. That's a diuretic, which basically causes the kidneys to pee out more fluid, and that just reduces fluid buildup that we get in heart failure. We can use something called pimabendan, and that's a drug that may or may not kind of help, but it can improve how well the heart contracts and how efficiently it kind of works as a pump, and also how kind of reduces the oxygen demand of the heart. We can use drugs like benazepril or other drugs within this class, which are called ACE inhibitors, and that can reduce salt retention and also fluid buildup, as well as reduce blood pressure, which may or may not help. And then I guess the last thing that we think about would be something called clopidogrel. So I spoke about the aortic thromboembolism, so the saddle thrombus. Now that forms because we get turbulent blood flow within the heart, and effectively certain parts of the blood within the heart can actually become kind of pretty stationary, and that then forms kind of little clots, which can then form bigger clots, which break away and cause those problems like I discussed. So clopidogrel actually stops those platelets clumping together, forming those little clots. Now, we can give this drug to any cat with heart failure. But if we're having ultrasound performed, if we're having something called an echocardiogram, so the use of the ultrasound to check out the heart, to have a look at the structures within the heart, and also to assess heart function, then what we sometimes see is something called smoke within the heart. And that is the blood, which is normally black, actually kind of being quite cloudy, which is little clots forming already. And if that's the case, then, definitely we should be reaching for this drug. And then finally, which isn't in every case of heart failure, sometimes we'll have an irregularity in that heartbeat, and a specific anti-arrhythmic treatment may be needed. So something to try and get the heart rhythm back to normal. Okay, and then finally, prognosis and life expectancy is actually very varied. So some cats, they'll only be presented when their chest is completely full of fluid. They're really struggling. Their bodies are shutting down, and in those cases, they will die straight away, unfortunately, or they'll be euthanized because they're struggling so much, and we're not wanting to put them through too much. In some cases, though, where the disease is progressing very slowly, we might get a lot longer. In other cases, even if we're not getting it at that stage when they're kind of on death's door, it will progress very quickly, and they'll go from being all right to very sick pretty quickly. And life expectancy, it can be anywhere from about 6 to 18 months in this case. So it's difficult to be any more specific than that. So I hope that answers those questions and gives you something to think about if you've got a cat with heart failure. Okay, and this is a good time to remind you that the information that I give in these podcasts is not a substitute for a consultation and examination with your pet's veterinarian. It should not be taken as specific advice for any individual pet. If your pet is unwell, if your pet's injured, or if they're suffering from any kind of a problem, then talking to your vet is always the best course of action. And then my final question today is from Catalina, who says, "Hi, I have a question. My friend is having a really hard time to apply eye drops to her pug. Can you kind of run through kind of how to do this so that the pug doesn't get too stressed, because she's already running away and hiding every time as soon as she sees the drops and won't even accept treats. She has to take them every day for the rest of her life. So can you help? Okay, so to start with, I'm going to suggest to ask the vet or ask the nursing team to demonstrate how they are actually applying the drops, because, you know, it may be that they've got some specific tricks that they know that this dog is going to kind of get on well with, or just show you kind of how to handle the medication and how to hold the eye open and hold a dog's head, because it is tricky and it does take a little bit of practice. You know, it's definitely a situation where of having a few more hands to help is beneficial, because one person can help hold the head still and open the eye, and the other person can administer the ointment. It's something that you can do by yourself, but like I say, it does take a little bit of practice. So ask your vet or nursing team for a demonstration. The next thing to suggest is to see if there are any alternative topical medication options that are either a kind of a different drug, a different kind of type of drug, or that are a different consistency, because you might find that actually having a liquid drop is easier than applying a gel, or vice versa. Some people prefer gels to liquid drops. Your dog might also prefer a change in the product. So the next thing to think about would be to actually warm the drops in your pocket before applying them. So if you're, you know, very often, certainly with long-term medications, they might need to be kept in the fridge, and applying cold drops to the eye can be quite uncomfortable or quite a strange sensation. So warming them in your pocket before actually applying them might help make them a little bit more comfortable for your dog's eye. And then the next thing, you know, this already mentioned that, you know, she won't even accept treats, but we really need to try and get an association between having treats and having a good experience with having the eye treatment administered and having the eye drops administered. So start by giving tiny treats that you know your dog will like, then move on to giving treats while touching your dog's cheek or their chin. So not handling their eyes, you know, not trying to administer any medication, but just having used to treats while they're kind of being handled, and then slowly work your way closer to the eye. Then, you know, start supporting the head a little bit more firmly. Start holding the head while you're giving treats. Again, maybe not handling the eye specifically. Then giving treats, holding the head and opening the eye. Again, not administering medication. And then finally, you know, hopefully this, you know, it won't take too long, but it might take a couple of weeks. You know, going through the same process and then applying drops all the while, trying to distract with treats. You can even do one eye at a time. So do one eye, we're not having any stress, fantastic, let's leave it, have a half-hour break, and then administer drops in the other eye. And hopefully if we take this stepwise approach, the dog will get used to having the eye medication, will actually learn to associate it with having treats, or we'll certainly know that, when it's getting treats, it's getting a reward for staying still and having the eye medication applied. If really we've done all those things, so, we've tried different consistency medication, we're warming it up, we're trying to give treats and we're not getting anywhere, or you're still really struggling, especially as this is something that's going to have to go on for the life of the pet, then, you really need to have an honest chat with your vet. You really need to let them know. And then you need to talk about, are there any other alternatives? So I don't know why this eye needs constant medication and lifelong medication, but you need to ask, are there any alternative treatments that might work? Are there any surgeries even that might be beneficial? We shouldn't be ashamed of saying, no, I'm really struggling, because our pets, be they dog, be they cat, they don't often let us do everything that we would like them to let us do, or everything that we really ideally would need to do. But there are often other ways, there are often other things that we can do to try and treat the same condition. So be open with your vet, don't be ashamed, or don't be think that they'll kind of think less of you as being a bad owner or anything like that. I can only help my patients and help my clients if I know that they're struggling. So be open with your vet and have a chat with them. So, that's a few things to think about, and I hope that they help you get this wee pug to have the medication it needs in its eye. Right, so that's it for this episode of the Dr. Alex Answers Show. Make sure you subscribe. I'd love it if you could share this episode with your friends and family. And also, if you have a couple of minutes, I'd really love it and appreciate it so much if you could leave me a review over on iTunes or over at ourpetshealth.com/review. And that will just help more people discover this podcast and allow me to help more pets. And that's really what this is all about, to try and help pets and help pet owners as well get their pet the best treatment, the treatment that they deserve and the healthcare that they deserve. Remember too to head over to dralexanswers.com, where you'll find the links and the downloads all mentioned in today's show. And until next time, I'm Dr. Alex. This is the Dr. Alex Answers Show. Take care.
You've been listening to the Dr. Alex Answers podcast. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show, where you ask the questions and Dr. Alex answers.